How many guys suffer from low back pain, right? That pain in the low back, it may radiate down your leg. You may have numbness into your leg, your foot, etc. And you go to your healthcare provider, or maybe you can look it up online and come to find out that you were told you're going to need surgical intervention, right? That's the only answer to fix this. Be very careful with your disc. Even, your disc is bulging a little bit. You've got, these disc bulges. Be careful because you don't want to end up, blowing the disc out or slipping the disc out of place. And so there's a lot of misconceptions with that. Number one, the disc is a lot stronger than what we give them credit for. A lot of people think that it's just this jelly sitting inside a donut. And I know that's good for analogy of showing the nucleus of the disc and all that, but it's actually very, very strong. It's very tough. And discs respond well to loading strategies. So, exercising, loading weight through there, it's okay. It's not like I've got two bulging discs, so the answer is don't lift on anything, don't pick up on anything, because it's like a ticking time bomb or whatever. It's going to come loose or it's going to blow out. That's actually not the case. And based on research, we know that performing, exercises, movement, mobility things, all of that can have a positive effect on disc bulges or protrusions. And honestly, a lot of times people also think that the disc is out. I got to get it put back in. Maybe some sort of manual practitioner is going to put the disc back in. And there's very poor, I'm not even aware of any research that supports that actually happens either. Then there is a desensitization that can happen. A lot of times with spinal manipulations or mobilizations, you can have this temporary pain relief, calming down of muscle spasms and all that, which during that window of time, that's when you take that opportunity to go through your movement patterns or your exercises or stretches to try to kind of maintain and progress from that additional range of motion that you got because some of the pain has been calmed down. Now, that doesn't mean that manual therapy techniques like joint mobilizations, manipulations, massage, acupuncture, dry needling, the use of modalities, electric stim, all those things don't work or have some positive effect for a lot of patients. But at the end of the day, the biggest thing you need to be doing is the exercises, the movements, going through full ranges of motion, putting those discs under a little bit of load and tension, and then progressively increasing that. That is how you truly can help the disc. Now, there are cases, yes, where you have to have surgical intervention, and those cases that that is the only answer, and I understand that. But for a lot of people, it's estimated like 50% of people throughout their lifetime are going to have some sort of disc bulge or protrusion or some sort of disc pathology. And a lot of those patients, it's asymptomatic. They don't even hurt. They don't even know that it's there. And what I see a lot is like a patient maybe, pulls their back, does something one day. They're out in the yard, working or maybe at work or whatever that is. And then they go and they have an x-ray or they have an MRI and they find things wrong with the back. Oh my goodness. You've got, they use these, big words, right? They got, facet arthropathy, spondylosis, spondylolisthesis. You have all these different things. I'm not saying that those things aren't medical diagnosis and they can't be significant and require treatment specifically for those things. But in a lot of cases, it's probably not the issue. In other words, you were in the yard and you picked up on something. Well, you go to the ER because your back's locked up, disc is out or whatever you've been told, and you go in and come to find out, they say, oh, you've got arthritis or you've got scoliosis. I've had patients be told that before by physicians, and this patient may be 60 years old. Well, guess what? They didn't develop arthritis at that instant, right? They didn't develop scoliosis right then. That's been going on for years. And so I'm not saying that it may be a contributing factor, but it's not the reason that they're hurting currently in most cases. And so you just encourage and reassure the patient to go through the movements, to go through these stretches and different movement patterns, exercises. That's all safe. You don't have to be nervous that, if I do this one little movement, it's going to cause these issues. Now, I don't mean go out and try to pick up a car or anything. I mean, that would be a little bit extreme. But just under the guidance of someone who, is qualified, to show you those things wherever you're at in the world watching this video, there are things that you can do. And it's not always surgery is the answer. I've got 3 bulging discs. What am I going to do? No, in a lot of cases, you can go through the exercises, a strengthening program, the mobility stuff, and then you can restore range of motion and get that disc or those discs to go back in like they should, desensitize the nerve roots, where the nerve roots calm down and everything kind of goes back to normal. And so you don't always have to have all these other great surgeries, elaborate surgeries, all these different things. And again, like I said, with manual therapy techniques, there is some research that supports thrust manipulations and things like that, especially in the lumbar spine, can have a short-term effect, especially when low back pain is acute in nature. So it's just recently come on, it's just a recent onset. But I would always follow that up with, those mobilizations with some sort of movement, and then progress into exercise or whatever that is. I would not just, for me personally, I don't just, would not just do manual therapy alone. I go into those exercises. Those are safe to do in most cases. And so just make sure you talk to your doctor, a healthcare provider, whatever, before, of course, you do anything that I talk about in any of my videos. It's all for entertainment and just general education. So that's just a little bit about back pain with disc pathology. I hope this video helps in trying to give you an idea that your discs are not as fragile as a lot of people think. And in a lot of cases, there are some things you can do about it conservatively. It doesn't always require surgery. Thanks so much for watching.